Hi, I wanted to make a video about my experience with our child and what doctors were suggesting in diagnosing her with periodic fever syndrome. The reason I want to do this video is because we were dealing with what doctors diagnosed as periodic fever syndrome for well over 2 years, I'd say. Our child was one. She started having fevers that occurred once a month, and at first we thought maybe it has something to do with her teething. And for a while we just chalked her fevers up to teething pains and so forth, and kind of just treated it as just that, as something that would pass with time. As all of her teeth came in and she still began to have these fevers, it was at that point where I really began to start paying attention and taking notice to these fevers, and started actually creating a journal or a diary of the fevers as they occurred monthly. And if your child is having these monthly or reoccurring fevers, I would suggest that maybe you do the same thing. Document when the fever started, how many days it lasted, what you did to treat the fevers. In our case, my wife and I would administer acetaminophen, and then we would piggyback that with ibuprofen or Motrin for children. Once again, back into acetaminophen and Motrin, and these fever episodes would last from anywhere from 2 to 3 days. And we were giving our child acetaminophen and Motrin or ibuprofen during the course of her fevers to help keep her comfortable and to bring her fever down. Now, of course, we would take our child to the doctor when she had these fevers, and the doctors typically would say, well, she's a child, she's a newborn, she's fairly young still, her immune system needs to build immunity to the various viruses and bacteria that she's going to come in contact with. And they pretty much just sent us on our way, telling us if the fever exceeds a certain temperature to give them a call if that lasts for more than 3 days or so. And typically her fevers wouldn't last longer than 3 days, but she did have some high fevers, and at that time she was not comfortable and wouldn't eat well, occasionally would vomit. So I began to then look into this further because I wasn't quite satisfied with the answers that I was receiving from our pediatrician. And I started going online and doing research on what the potential cause could be for these reoccurring fevers. And I have to say that as I was documenting her fevers, I clearly began to see a pattern develop, almost that I could pretty much predict within a week or a few days as to when she was going to get her next fever. And typically it was anywhere between 4 to 5 weeks, and within that time frame I could get pretty accurate with when I thought she was going to have a fever, call it, and sure enough she would have a fever that lasted for a few days. So it was at that point where I really began to start questioning our pediatrician, and also began to look into second opinions for what was causing this. And I'll tell you, I started looking on the internet. I started reading a lot of different books, and just try to get as much information about what might potentially be going on with our child to try to get some answers, because I really wasn't happy with the answers that my pediatrician was giving me. I don't know, call it parents' intuition. this was our first child, and I was still fairly new to being a parent. However, I felt in myself that something clearly wasn't right here, and the doctor's telling me that she'll get over this as she gets older, or as she ages, this will be something that just disappears on its own. Wasn't quite a good enough answer for me. Furthermore, I couldn't let my daughter continue to suffer every month for some unforeseen time in the future when it would just magically disappear and not happen to her. And for me, that just was no way for our child to have a childhood that was going to be normal or happy. And so I began to look into what else this could possibly be. So I also began to look at various forums and online chat rooms and message boards, and started conversations with other parents who were also experiencing the similar symptoms with their children, and hearing the same stories and diagnoses from their pediatricians. And I ultimately concluded that she was having a reoccurring infection in her tonsils. Now, it wasn't until our daughter turned 2 when she could actually start talking to us and communicate to us what was bothering her when she had these fevers. As she had these fevers when she was 1, leading up until she was 2, and then after 2, it never occurred to my wife or me to inspect her throat or look into her mouth and to see if there was something that might have been bothering her and creating the fevers which she was experiencing. It wasn't until a little bit after she turned 2 when she was able to actually vocalize and speak and communicate to us that her throat hurt her when she had a fever, that we began taking note of her tonsils. And I guess it's worth noting here that whenever she had a fever, there were no other symptoms that were involved. It was simply a fever. There was no cold-like symptoms, no cough, no runny nose. All she ever had was the fever, with no other accompanying symptoms, which for me seemed to be a bit strange. And it wasn't until she was able to communicate to us that her throat hurt her, where we made the connection that every time she had a fever with no other symptoms, her tonsils were always infected. And sure enough, every time we noticed that she had a fever and was starting to get a fever, we'd look into her mouth, open up her mouth, look down her throat, and we can see that her tonsils were infected. You can see that her tonsils had what looked like some white pus on them, and they were swollen, and they hurt her throat. And that's pretty much how we concluded that we need to remove her tonsils, and that might be the possibility of why she's constantly getting these reoccurring fevers. Now, it was surprising to me that our doctors, our pediatrician, never was able to identify this. There were times where we took her in for a fever, and we called attention to her tonsils being infected, and the pediatrician did the swab for strep, and got the test results back that she was clear of strep and that wasn't the problem. It was just an infection. For me, the fact that the infection was reoccurring every 4 to 5 weeks seemed to be a bit odd to me. And once again, the doctor's explanation for that was that it was something that she would grow out of over time. That, for me, was not a good enough explanation or answer for how to cure our daughter. And it was at that point where we really heavily considered having her tonsils removed. Now, because she was only 2, my wife and I struggled with the decision of having her go through that procedure. And so we waited until she turned 3 to actually have her tonsils removed. Now, we weren't certain that removing her tonsils would be the reason, or actually would help resolve her reoccurring fevers. But as I mentioned earlier, as I was looking into what could possibly be causing her fevers, and as I was speaking with people on message boards and forums of other parents who experienced the same thing, I began to realize that in many instances, the people or parents who had children that were suffering from the same symptoms as our child explained that once they had their child's tonsils removed, that the reoccurring fevers stopped completely. And it was at that point where we began to heavily consider having our daughter's tonsils removed as well, because we made the connection with seeing her tonsils infected simultaneously while having these reoccurring fevers for 3 days at a time and so forth. And it was just pretty obvious to us that we probably had to have her tonsils removed. Now, the doctors never suggested that. It was something that we actually insisted on doing with our doctor, and our doctor, was against it and wanted us not to do it, and had to prepare the referrals to the professional doctor or surgeon who can perform this procedure for us, and really wasn't supportive of the whole thing. Now, it seemed at that time I was struggling with the idea of having to remove her tonsils as well, because it seemed to me a bit, I guess, ignorant, if you will, in thinking that because her tonsils are always getting infected, that if we remove them, she would just get better because her tonsils would not be infected. Almost as if my child consistently bumped into a wall and was hurting her arm, the solution to that would be to cut her arm off, and now she would no longer hurt her arm if she bumped into a wall. This was the decision that I was struggling with, because it seemed a bit ignorant on my behalf, or naive, to think that by simply removing her tonsils we could address the problem and solve it altogether. So there was a bit of speculation on our part, my wife and I, to actually have our 3-year-old daughter, once she turned 3, go through with this procedure. However, I'll say this, that we did decide to go forward with having her tonsils and her adenoids removed. And after we did that, the reoccurring fevers no longer occurred. And it's been quite some time now. She's 4, almost 5, she's 4.5 or so, and the reoccurring fevers no longer occur. They've pretty much gone away at this point. Now, she no longer has tonsils or adenoids. However, she no longer also has the reoccurring fevers, which were causing a lot of stress in her life for such a young child. So I guess I just wanted to make this video to share my experience with parents out there who might have a child who is suffering from what the doctors call periodic fever syndrome. Now, the reason they call it periodic fever syndrome is because they really don't know what the cause of these fevers are, or at least that's what they told me. In fact, I about had enough with our pediatrician when we went in one time to have our daughter looked at because she had a fever, and our pediatrician comes to our room and hands me a packet of printed material from WebMD about periodic fever syndrome. And when she handed this to me, I politely handed it back to her and had to tell her that this was all material that I had already read and didn't need to read it again, and that I had that information at home. And I truly did read that information that she handed to me, and it was at that point where I knew that we had to find